Good girls. Okay, drop it. It's kind of humbling in one sense because you're now not the doctor, you're on the patient side. And even though I treat breast cancer, I know pretty much, everything they're gonna say. It's still very interesting to be on the other side and realize, what patients go through. Ready? I found out I was diagnosed with an invasive ductal carcinoma of the right breast in May 11th, 2023, which happened to be my birthday. I looked at the images, I look at mammograms all the time, and I was like, oh, it looks good. I told the tech, it looks good, and that was a Friday. I came back on Monday, and Dr. Segner, the radiologist, had called me and said that initially on the 2D images, everything looked fine. But looking at the 3D images, there was something of concern. So she immediately scheduled me for an ultrasound. And I underwent the ultrasound, and I was actually looking at the images. And when I saw the images, I was like, well, that's a breast cancer. I knew right away. After that, because of our family history of breast and ovarian cancer, I had requested genetic evaluation and testing. And when I did that, then I found out we were positive for the BRCA2 mutation. So after I found that out, I already had planned in my head what I wanted to do, which was I wanted to do bilateral mastectomies, and I wanted a tissue reconstruction. I don't want to take the chance of developing another breast cancer, so I chose to do bilateral mastectomies with a deep flap reconstruction, which is where they take the abdominal fat and reconstruct breasts from that. Now, of course, you don't need to do that. We have good ways of following patients, but that was my personal decision. And I had made that decision a long time ago, even before. If I was ever diagnosed, this was what I was going to do. And because my cancer is triple positive, then I was recommended for 2 separate chemotherapies, one to cover the estrogen and progesterone part of it, and one to cover the HER2/neu part of it.
Dr. Bruce did amazing during treatment. She really had minimal side effects.
I was referred to Dr. Sales for an evaluation of radiation, and she did recommend to do radiation. Even though I'd had bilateral mastectomies, she wanted to do radiation to my sternum where lymph nodes from the breast drain, and my axilla where the lymph nodes had drained that were positive. In January of 2024, I started doing radiation, and I did 28 treatments with radiation.
She actually went to Caldwell when she got treatment. So we've got a site in Caldwell, Nampa, as well as Boise. So she was actually at the Caldwell site, and that was just close to home for her and really helped to facilitate her being able to do all her stuff at home in addition to getting radiation treatment.
Not back. I have a new perspective on what my patients that I've been taking care of for years are going through. And I think it's important, especially when a patient is faced with a new diagnosis, for me to be able to say, hey, it's okay, you're gonna get through this. I know this because I've gotten through it. And if they ask me, what happens when I lose my hair? What happens if I do have, mastectomies? What am I gonna feel? I can tell them everything that I've experienced. And it's definitely different when you've been through it yourself than telling people what you learned in, surgery residency about what they're going to experience. So I think that, and I've already seen with several of my patients, that they really trust me, maybe more, because I've been there.